The world has lost a great man. The Physicians Committee would like to offer our deepest sympathies following the passing of Dr. Baxter Montgomery. He was the 2010 recipient of the Physicians Committee's Benjamin Spock Award for Compassion in Medicine. You see, he was so many things. He was a visionary. He was a cardiologist, yes, but a trailblazer in the field of lifestyle medicine. And it was through his work at Montgomery Heart and Wellness that he championed the power of a plant-based diet to prevent and reverse chronic disease. And he transformed the lives of countless patients. These were people who traveled from across the country and even around the world to seek his care, not just because of the world-class facilities that he provided, but his extraordinary advocacy on their behalf. He worked tirelessly to revolutionize medicine and empower people to take charge of their health. And by doing so, he paved the way for a new model of care. We are so grateful for Dr. Montgomery's countless contributions, and we feel his loss very deeply. And so today, on this special episode of The Exam Room, we look back at Dr. Montgomery's final appearance here on the show. He transformed thousands of lives with each appearance, including this very one. And with that, welcome to the Exam Room Live, and rest in peace, Dr. Baxter Montgomery. Continuing our look at heart health here on the Exam Room podcast, brought to you by the Physicians Committee. Hi, I am the weight loss champion, Chuck Carroll, and today we are privileged to be joined by the medical director from Montgomery Heart and Wellness in Houston, Texas. He is also the man behind this exciting new docu-series called Heart and Soul of a Champion, the first season just about to be released. We have so much to talk about here today. Just absolutely extraordinary. Could not be more excited to welcome Dr. Baxter Montgomery back to the Exam Room. My friend, thank you so very much for taking the time.
Wonderful. Thank you very much for having me.
You are incredibly busy right now. I know you're ramping up, getting ready to release the first season of Heart and Soul of a Champion, which focuses on athletes. I believe it's even called the Athlete Edition.
Yes.
Let's talk about this series. I had the opportunity to preview the first couple of episodes, and I got to tell you, this is one of the best documentaries that I've ever seen. Not just a plant-based documentary. The way that you're able to relay information and do some incredible storytelling, I think is quite literally going to change and save a lot of lives. So before I even ask the first question, I wanted to give you an attaboy and a pat on the back, because this is a powerful piece of work.
Yeah, thank you very much. I really appreciate that. Thanks for the kind words. It means a lot.
Absolutely. And so this new docuseries, let me tell the Exam Roomies a little bit about it. As you put on your website, heartandsoulofachampion.com, this is innovative, life-changing Montgomery Heart and Wellness integrative health program, which is a mouthful to say, but basically what this is, Dr. Montgomery, is the future of medicine. That's what you have impressed upon me in our conversations leading up to this. Why do you consider this to be the future of medicine?
You know, I think it's a necessary future because our current way of practicing medicine is one that doesn't give us very great returns. You know, we spend more money year after year on what we call healthcare or sick care, some people may refer to it as. But despite that, we get sicker. Illness has become the norm. Since 2019 up to now, and from 2019 to 2021, the life expectancy here in the United States has decreased by 2.7 years. And that's the lowest it's been since 1996. And so, you know, we are in a healthcare crisis. So the current approach to medicine, which is strictly using prescription medications and procedures and surgeries without any attention to aggressive lifestyle intervention, is one that has to change. So it's our, thinking at Montgomery Heart and Wellness is that lifestyle intervention should be the foundation of healthcare. And so our approach to this approach using integrative care uses a lifestyle intervention first and foremost, not only in the setting where you're trying to prevent something from happening 5 or 10 years from now, but if someone's acutely ill, lifestyle intervention needs to be integrated with any other type of acute medical intervention. If someone has some chronic illness on a lot of medications or have pending surgeries, an aggressive lifestyle intervention has to be intervened. So what the docuseries does is that it pulls the curtains back and allows the viewer to see exactly what that means. And it does it in the context of seeing individuals coming and changing their lives, coming and going through their lifestyle journeys. It shows the ups and the downs. It shows some of the challenges that are involved. And the storytelling aspect I thought was very important because we often deal with disease states as statistics. X number of people with heart disease, X number of people with diabetes, et cetera. But we all have to start to put a face behind these diseases, and hopefully the docuseries will help us do that.
The thing that I really enjoyed about this documentary, this docuseries, is that it really does, as you were saying, a phenomenal job of storytelling. But you're not just telling simple stories here. I mean, you have NFL Hall of Famers in this docuseries, but then you also have somebody who would not be recognized on the street, and yet somehow I became as emotionally invested in Mr. Antonio Pope's story as I was with Hall of Famer Darrell Green. And so I actually want to start with Mr. Pope, who had been to a number of hospitals, a number of doctors. And this was even mentioned in the docuseries that one of the hospitals did not want to do anything with him because his heart was only pumping with 10% efficiency. And as I understand it, he was on kind of like a last chance medication just to be able to survive day to day. When somebody comes through your doors and they are in that rough a shape, I mean, what goes through your mind as a doctor? Are you thinking always that this is something that is correctable, or like, how do you even begin to wrap your head around this as a doctor?
That's a great question. And we frequently see patients like Mr. Pope who come to our center, whether they're local or from out of state, patients flying from around the country. And Mr. Pope was on a Milanone infusion pump, which is a medication, as you indicated, is one that's typically of last resort or sort of a late term, therapy for patients with heart failure. And what I'll say point blank is that it doesn't matter how sick the patient is. It's always my mindset that there's a chance it can turn around, and a very good chance it can turn around. And I don't say that just to be, bragging or say that just to be arrogant. But that mindset is based on our experience. We've had patients who were so sick they were given up for hospice. They were too sick for surgery. I've had some patients on life support with whom we are able to help their bodies turn around and then walk out of the hospital. So we've seen firsthand individuals who are very, very ill in dire straits, whose body is able to turn around when the right type of approach is used. Now, that doesn't mean it always happens. It just means that there's a possibility, and a very good possibility, that they can turn around. So that's one thing. So our experience tells us that this can happen. But the other reason I have that mindset is that it's important, and I try to convey this to my patients, it's always important that you have a positive, a can-do mindset, because all of our possibilities start with the mindset that this can happen, the mindset that we can do this. So if I'm their treating physician and I don't have the mindset that, hey, you're going to get better, then my goodness, that puts the patient at a major disadvantage. So I always have the mindset that my patients are going to get better, and I have the mindset I'm going to do everything I can to help them achieve that. And so the answer is yes. When Mr. Pope came, we were of the mindset that we could help him get better. We had a game plan in place, and that's our approach with every patient who come in, despite how ill they are.
And I think that it was kind of obvious that at least his sisters who had traveled with him from Virginia definitely shared that mindset. If you're willing to travel all that way after being told you're too sick to even operate, I think that goes like never give up mentality. And that really is critically important. I mean, we've seen that even bore out in studies. The more positive a person's mindset is, the better their health outcome tends to be. Is that all psychosomatic, or is there something physiological that happens in the body because you have this can-do attitude as well?
I think it's physiological. I mean, we call it psychosomatic. I mean, that phraseology is probably linked to the biology of, the physiology of it. I mean, you have to have the confidence that you can do things, because your body then directs the rest of your physiology. The brain directs us in terms of where we want to go and where we need to go. And so, if we have the mindset that we can do something, it gives us a much better chance of doing what we plan to do. So that goes, for getting well. And it can also, conversely go for being sick. If you have the mindset, well, I'm sick and I'm very tired all the time and I'm not going to get better, then that negative mindset is going to work against your body's ability to heal itself. So it starts with the mindset for sure.
And let's also talk about how your mindset shifted very early in the docuseries. I mean, it was like straight away, you talked about this big breakthrough that you had at the age of 35. And you went through this detox at that age. What led you up to that point where you realized, my health isn't quite where it needs to be? Let me find out what else I can do.
It's interesting because, I was, like I often say, indoctrinated into this, aggressive medical training. My background is in internal medicine, and my next subspecialty is cardiology, and then the subspecialty, cardiac electrophysiology. And after many years of training, that I was also in practice for a long time and using these skills and the like. And it was when I noticed my health started to deteriorate. The simple inspiration was that I didn't want to take the medications or undergo the treatments that I was prescribing other patients. It was just that simple. It wasn't anything too profound. And so I started, researching natural cures and things of the like. And I came across one common denominator is, healthy diet. And the common denominator of a healthy diet was plant-based nutrition. And so one thing led to another. And my personal experience was that I started off a nutritional detox, a juice feast, and I felt amazing. And so, when I saw the incredible effects it had on me, I then thought to myself, let me try this on some of my patients. And I tried on some of my patients who were very ill. And lo and behold, I saw amazing positive results in patients, not in a matter of months or years, but in a matter of days to weeks. I saw some of the things that I'd never seen in my medical practice ever, in terms of just simply putting patients on a natural plant-based diet. And so, in 10 days to come back, I was able to wean them off medications and get them off oxygen and have them walk when they couldn't walk. And these were miraculous things. And again, I practiced more than a quarter century in the world's largest medical center. We have 3 heart transplant centers in walking distance. We have everything in medical technology any place on the planet Earth for the most part. And so it's not like I wasn't exposed to the best that medicine had to offer. But despite being exposed to that, by simply putting patients on a natural plant-based diet, I saw amazing health recoveries that I had never seen before in my professional practice in the world's largest medical center.
All right, so let me ask you kind of a fun question then, because when you're talking about prescribing nutrition essentially and a healthier lifestyle, I mean, that's so counter to the majority of advice that is prescribed by doctors, right?
Yeah.
Were you nervous at all the first time you brought that up with a patient? Were you like, I don't know how they're going to react to it, but I'm just going to throw it out there and see if it sticks?
That's an interesting question. I don't think I've been asked that question before, but I really wasn't nervous. I mean, looking back on that experience, I was so excited about it that it really didn't, sort of like, you're finding, something amazing in your house and you're jumping up, running around the neighborhood. You don't realize you're having pajamas on or something in your underwear. I don't know. But the point is that when I started, recommending this to patients, I was already overwhelmed with the positive benefits that it had, and that I personally experienced. But one thing I realized that it was going to be challenging, because I wasn't telling patients to cut back on this and cut back on that. I was having patients go strictly on raw plant foods, not a bite, drop, or crumb of anything other than that. And so I knew that that was a very, very challenging, dietary change. So I wasn't using the traditional moderation, make change, eat more salads. No, eat only salads, drink only water or cold pressed juice or smoothies. So what I did is that, unfortunately, I used this approach early on. I would do very quick follow-ups. So that was the key. So I'd start someone on the regimen. I'd write out specifically what they had to eat, write out what they had to avoid 100%. And I said, come back and see me in 7 days. Now, that 7 days, coming back, get the repeat sermon was important because it allows for a high percentage of compliance in that 7-day period. That's number one. Number two, the fact that the regimen was so precise, as I like to say, some people say so extreme, that they got results, positive results, in a very short period of time. So in 7 days, they're coming back, and I'm able to cut back on the medications and weights down a lot, et cetera. So they're doing so much better in 7 days. So even though they're struggling with the diet and struggling with missing their so-called favorite foods, they have the counter experience of positive results. And so then at that 7-day mark, I said, well, wait, give me another 7 days, and then another 7 days. And so we worked out this whole process that we created like a 4-week arbitrary period of time, and we created a nutritional boot camp class and detox. So over time, I created more and more support materials, because one thing I learned is that people were able to comply with this. They just need more support, more encouragement, group classes, and the like. And we create these programs over time.
What are your group classes like? I have seen them work kind of as a double-edged sword, right? On one hand, they can be really, really, really great. But on the other hand, I've also seen where it can quickly turn into a group of enablers. How do you ensure with your groups that they kind of stay on the straight and narrow?
It's a great question. We've had good results with the group program. So we started out with what we call as a nutritional boot camp class. So the original boot camp classes, and the boot camp classes developed out of my one-on-one consultations when I would have patients come back, a series of 4 7-day periods and what have you. So I started to do it with large groups. I say large groups of say 25 to 30 people in the group. We hold them in our main lobby, and they were on Saturday mornings, sometimes Saturday mornings and afternoons, and then sometimes Sunday mornings when the class filled up. But what we did is that we had a curriculum. It was a structured program. So creating structure really made a difference. And the food prescription aspect was very important, because we were very precise in terms of telling people what to eat, what not to eat. That's one. Also, we had developed what we refer to as a food classification system. It's a simple 0 to 10 classification system, where the lower the number is, the healthier the food, the higher the number, the least healthy. Plant-based food stops at food level 6, level 6. And so we don't recommend people eat beyond level 6. The sicker they are, the lower the numbers. And so we may prescribe foods in a different, range, say 0 to 1 or 0 to 3 or 0 to 4. So we use that as an approach to so the level of precision helps people out. I started out moderating the class. I trained nutritionists to then moderate the classes. And then we also had support with our chef. We eventually built a nutrition center and then a restaurant and grocery store on our site, which also supports. So creating structure, precision from the standpoint of food prescription, and also, giving support in terms of the foods and recipes and the like, I think helped us out tremendously.
I think so. I mean, that all-in-one kind of approach there is really important, especially early on in their journeys. I think as they transform and break all of those old habits, to have that solution right there with the grocery store, with the cafe, I just think that is key. As someone who had a lot of unhealthy heart habits back in the day, I think, that all-encompassing approach is absolutely critical. You mentioned that you're within walking distance of 3 world-class heart transplant centers there. One of the questions that has never been raised here on the show is what is the benefit of a plant-based diet, a healthy diet on somebody who has had a heart transplant at that point? Do they still get the same benefits as somebody who has not undergone that? Like what is the upside there?
Well, I won't say the benefits are exactly the same. Someone who's had a heart transplant, for instance, we won't be able to wean them off all of their medication. We'll have to leave them on the anti-rejection medications. With that being said, there are other benefits that are very good. So, for example, if I have someone with a transplant of any organ, heart transplant, kidney transplant, they benefit from a natural plant-based diet because it reduces other problems. I mean, they also are at risk for hypertension, hyperlipidemia, they're at risk for liver dysfunction, et cetera, even though they have a transplanted organ. So if you're eating a natural, healthy diet, it allows the body to maintain biochemical and physiological balance. So, I mean, if you look at the flip side of that, if someone is had a transplant and they're eating junk food all the time, well, a bad diet, just look at the immune system, since it, naturally applies to a transplant situation. In the transplanted patient, you don't want to have the immune system revved up. That's why you have anti-rejection medication, which suppress the immune system, because you do have, even though there's a certain amount of tissue matching, there's still a foreign tissue in the body. So there's a risk of rejection, and that rejection is going to be mediated by the immune system. So if you're consuming a diet that's very unhealthy, an unhealthy diet creates immune disarray, which could be an immune system that can be overly suppressed, but it can also be an immune system that's revved up. And so an immune system that's successfully revved up can potentiate rejection more aggressively than an immune system that's kept in normal state of condition. So a natural diet, consuming natural foods that are designed for the human body, allow for the immune system to be robust, but also under control. But if you're consuming unhealthy foods, that immune system will not be under control. And if it's overly suppressed, then you'll be predisposed to infections and cancers. If it's overly revved up, then from the transplant patient standpoint, they're going to be at risk for rejection. So these individuals benefit at least from that standpoint, in addition to the fact that they have less arthritis, so they have less hypercholesterolemia, they're on fewer other medications that may have drug-drug interaction. So you're really looking at very similar benefits in both populations. The main exception is that someone with heart failure who hasn't had a transplant has a chance of being weaned off all their medication. A post-transplant person does not.
Forgive me, I'm not too familiar with heart transplants. What is there kind of an expiration date on a heart that's been transplanted? Is it 20 years? Is it 30 years? Can it last a lifetime?
Yeah, there are individuals who I've seen who live with a heart transplant for 20 years and they do very well. The individuals who have lots of complications, they may die within a year or two. And everyone's course is different. And I think the reasons are simply related to what I outlined. When we do a heart transplant, we don't necessarily pay attention to the person's lifestyle. So if someone gets the transplant, they get the anti-rejection medication and they're sent home. But where's the food prescription? The same thing when someone gets a bypass surgery. Where's the food prescription? Same thing when someone gets a stent. Where's the food prescription? So, we go through a lot of trouble and do these wonderful things. We have very talented physicians, very, expert, medical teams, and we're doing these amazing things for patients, but then it's sent home and there's no attention paid to what they're putting in their mouths. And so you have a broad spectrum in terms of, who's successful, who's not. And a lot of it has to do with how well they're taking care of their bodies. And the patients that we've seen who come in post-transplant, there's a heart transplant person we dealt with came to mind, and she did quite well. She did better after she underwent our detox program. We were able to wean a lot of her medications off. She felt better. Her functional status was better. She exercised longer. And so even though she wasn't going through rejection before, her health improved because the body's more than just the transplanted organ. It's the body working in concert with other organs as well. So yeah, the lifespan varies because and it's really hard to put a pinpoint on that because the lifestyle of the individual varies, and we don't pay enough attention to that.
Yeah, I wish that I really doubt that there have been studies on the effect of diet for heart transplant recipients. But if
Not
there were
really.
to be one, I mean, I assume that the plant-based diet, your hypothesis anyway, would be that would certainly aid in promoting a greater longevity for that person.
Yes, I think so. I think so for sure.
All right, let's go back to the docuseries here. One of the things that caught me off guard, in all honesty, you have Darrell Green, who is a world-class athlete, Hall of Fame NFL player, a legend here in the Washington, D.C. area for his time with the Commanders. And I was shocked that here's this gentleman, 62 years old, still looks to be in pretty good shape, and his blood pressure was through the roof. How common is it to see somebody that's relatively fit have such enormously high blood pressure? It was like 191 over
114, yeah.
114, yeah.
Yeah, it's we see it quite often. I mean, obviously we have a skewed population, but we see it quite often because they call blood pressure the silent killer. Coronary artery disease is a silent killer because you have individual, and one individual, Mr. Banks, had coronary disease, and he was perhaps the most physically fit in the group. But it's very common for us to see individuals coming in with elevated blood pressure. They don't know about it, especially if they haven't seen a doctor in a very long time or haven't checked their blood pressure in a very long time. We can see it, and again, it undergoes the biochemical imbalance. And the way I would think of it is simply this: if you're having a heavy downpour of rain, and people are just walking through the rain, and let's just take away raincoats and umbrellas. If you're walking through the rain, then what percentage of people are going to get wet? Well, pretty much everybody. And so I look at the standard American lifestyle as the rain. If you walk into the standard American lifestyle way of eating, primarily the standard American dietary lifestyle, 100% of the people are going to get sick in one form or fashion. Now, that illness may not be hypertension, it may be high cholesterol, it may be liver dysfunction, it may be mood disorders, it may be obesity, but 100% of people are going to get sick, and how they get sick is determined based on their genetics. And essentially, that's what we're dealing with here in the United States. People are walking through the standard American lifestyle and the standard American lifestyle way of eating, but also lack of exercise and the like. And what's happening there is that these individuals are suffering from chronic illness. That's why sickness essentially is the norm. And so it's not uncommon to see someone like Mr. Green come in with a blood pressure 191 over 114. However, we didn't flinch. We talked to him. We didn't, get alarmed. We addressed the problem, and the viewers will see, exactly what we do in the docuseries.
I loved how you had a quorum with the other staffers in your office to determine what the course of treatment was going to be. I honestly love that part of the docuseries as well, as you guys kind of talk about what that course of treatment is going to be and the reasons why. And you do a great job of walking the viewer through that. So my hat's off to you. I don't want to spoil it for anybody, but it is just fascinating. I do have to ask you about one of the things that was involved in that treatment, and you mentioned it already in the interview, was the infrared sauna. What in the world is this thing? How is that benefiting a person's health?
Yeah, infrared sauna is a modality we've recently added. It's been around for some time, but the science behind it is that it's very effective in individuals with heart failure. There's data out of Japan and also data out of Finland. And so the data out of Finland is not only with patients with heart failure, but also coronary artery disease. What we do know is that it allows for red blood cells and probably even endothelial cells to increase nitric oxide production for the reduction in blood pressure. It creates a physiological exercise effect, and the mechanism there is probably the fact that the body has to maintain the regulate its temperature and temperature regulatory mechanisms, often involves increasing cardiac output or increasing circulation. But there are other things that some scientists have found out at the cellular level. So it's found to increase heat shock protein 60, which helps maintain intracellular protein molecules to keep them from denaturing. And there are many other, components of benefit that has been found to as a, in sauna therapy to be beneficial.
My man was sweating in there too. I mean, it is a sauna, but boy, he was glistening, man.
They have documented removing toxins out through the sweat, through the skin. So that's another mechanism. So it's sort of a direct detox effect as well.
So, okay. Yeah. So that's a real thing. So when you're talking about expelling toxins from the system, I mean, how important is it that we sweat?
Sweating is important. I mean, one, hopefully people, have effective sweat glands, but sweating is important because it does move toxins through the skin, through the system. And again, you want to be in a situation where you can sweat. So you want to make sure you're well hydrated. And that's why we emphasize hydration, in any setting, especially in the setting where individuals are getting sauna therapy. Hydration is very important because it improves, your internal showering effect or circulation, and allows your body to flush toxins out through whether it's through the GI tract or through the kidneys and the urine, or through the skin with sweat. So our need to flush and cleanse our system, either by sweat or bowel movements or urinary output, is important. And so that's how we cleanse and freshen and flush out. Sort of like power washing your driveway periodically.
All right, just a couple of more here. Thanks for being so generous with your time. I want to do some things here, just kind of really focus in on some practical tips that people can walk away from today and put into practice with their own life. And one of the things that I would love to hear you talk about is what the effect on cardiovascular fitness would be if somebody were to eat a regular baked potato versus chopping up that potato and then frying it in oil and turning it into a French fry. You still have potatoes, but what's the difference with the cardiovascular fitness there?
Yeah, well, certainly the fried potato will have adverse effects on the vascular system. And so you probably have, just by consuming the fried potato, you cause damage to the endothelial cells. You have the fried oils and the fried potato itself. You have you'll increase oxidative stress and inflammation at the same time. And that has adverse effect on mitochondrial function, which then has reduction in ATP production, which then has reduction in cardiovascular performance, and so on and so forth. So the fried potato is not very, very healthy.
You don't say.
Yeah.
I assume we can put potato chips into that same category.
I assume so. That's correct.
Okay, but now somebody, in all honesty, Doc, may be watching this and say, yeah, but what about the baked potato chips? Aren't those a healthier option?
Some baked potato chips are baked with oil. So you have a heated oil, which is very problematic. Now, is a baked potato chip less evil than a fried potato chip? I don't know the answer to that, but I think they're very close. There's somebody in our situation, when somebody's coming who's in the throes of heart failure, whose blood pressure 191 or 114, a baked potato versus a fried potato, it doesn't matter. Neither are going to help them out. And so we just throw them both out. But I guess if someone's trying to split hairs and say, well, the baked potato is not as evil as the fried potato, they might have an argument there, but it's not going to help their health long-term or even short-term for that matter.
Right. And just clarification, we're talking about a baked potato chip, not just a regular baked potato. That's right. Nothing wrong with the regular baked potato, right?
Yeah. If you don't overbake it, if you don't, like some people like overbake it and it's like, dark and stuff like that, I'd rather boil the potato. But if you ask me my preference on potatoes, I go boil first and bake second, and then, avoid the rest.
Right. So, well, I think just from a flavor standpoint, that's not bad because you're going to get a softer potato at that point, right? So, and the chars, that's really kind of the problematic part, correct?
That's right. Yeah. So that's why I'm careful when I say baked potato, because people aren't always careful in terms of how they bake their potatoes, and you get the char, which can cause, the charring of the carbohydrates, creates acrylamides and probably other toxins we don't know about.
All right. And last question for you. If you were to give your patients a list of maybe 3 to 5 foods that you would consider to be the heart healthiest, what would be on your list?
Well, first and foremost is a good quality water, an alkaline water. Some people can use distilled water reinfused with plants. That would be number one. Number two would be very hydrating foods, whether it's a cucumber or a cantaloupe or something. So like the melons are very high, celery. So very hydrating raw plant foods. And then, of course, the leafy greens would be a very close third to that. If you're going to eat cooked foods, the cooked foods I would recommend would be either steamed greens or beans that are cooked if you're going to eat cooked food. So those would be at the top of my list. But I go after the hydrating plant foods first, and right behind water, and maybe the hydrating plant foods maybe even before water. So if someone's able to consume 4 cucumbers and half a cantaloupe of water, you're going to be hydrated very well, and you may not need so much water. But hydration, foods that are very hydrating is very high on my list. And then next to that will be leafy greens, which may not necessarily be very hydrating if you're talking about spinach and kale. Broccoli is hydrating with the stems, but they would be very next on the list because they have lots of protein and minerals and phytonutrients. Sea vegetables will be mixed in that with the land greens because they're very high in minerals, because many of us are deficient in minerals. And then if you want to add some cooked foods for savoriness, you can have your boiled potatoes. It would be that preferably a yam or some of the smaller purple potatoes if it's not a potato, or beans. Black beans I think are good. Red beans are good, or the like.
You're putting a premium on hydration there. And it wasn't too terribly long ago, I was reading an article that was saying that a lot of us in this country, chronically dehydrated and don't even realize it. Why is that so dangerous when it comes to the heart?
Yeah, it's very dangerous because it's a great question, and it's something we deal with a little bit in the docu-series, but without spoiling that, someone who's dehydrated, just think about it. If you think about circulation, circulation requires a fluid medium, to circulate. So if the heart's going to circulate blood, and let's say a normal cardiac output is just a term we use for circulation, is 5 liters per minute. So that's a certain amount of volume being circulated over a certain unit of time. So if I have, 5 liters a minute, and let's say that the heart can, squeeze out, that 5 liters in a matter of 40 beats in a minute, or, let's say 60 beats in a minute, it can circulate 5 liters. But then if the body only has 2.5 liters, then the heart's going to have to beat faster because it's having to circulate the same amount of volume with the same amount of circulation volume per unit of time with less volume. So in other words, the smaller amount of volume I have, the more frequent I'm going to have to say, scoop the bucket. If I have a bucket that's a liter versus a bucket that's half a liter, I've got to scoop twice as fast with the half liter bucket than I do with the full liter bucket. So the more volume you have, the less frequent your heart has to contract, therefore to circulate. The less volume you have, the faster heart has to beat, and then therefore it works itself. So we see a similar type thing in someone with congestive heart failure. Congestive heart failure, by definition, is the inability of the body's heart to circulate blood commensurate to the body's needs. So if someone has a weak heart that can't circulate adequately, that's the underlying cause of poor circulation in someone with heart failure. But then let's say someone has a normal heart, but they have a normal heart, but then they're very, very dehydrated. When they're very, very dehydrated, then they're not able to circulate blood commensurate to the body's needs. So if you look at somebody who's with a normal heart, quote unquote, but who's severely dehydrated, they have the same end result as somebody with an abnormal heart that's weak, that can't circulate blood commensurate to the body's need in the same fashion. So if you're very, very dehydrated, And many of the symptoms of severe dehydration are similar to that of heart failure. You're, to some extent, giving yourself a similar physiology of somebody with heart failure. And so by simply hydrating yourself more effectively, you can counter that. There's a book, and I'm blanking on the author's name. Is a very long Indian name. They call him Dr. Batman, but he has a book titled "You're Not Sick, You're Thirsty." And he outlines a lot of chronic illnesses that people have that are simply due to dehydration.
Fascinating. Absolutely fascinating. Man, I could talk to you for days, but here's the deal. Let me give you guys a couple of important dates to keep in mind. Number one, March 18th. That is the premiere of Heart and Soul of a Champion Season 1, Athlete Edition. This is a must watch, and if you just can't wait, head over to heartandsoulofachampion.com right now. You can register and get the first episode absolutely for free right now at the website. We've included a link for you down below in the show description or in the episode notes. And Dr. M, I can't wait for you to come here to the DC area, because you're going to be speaking again at the Fairfax Veg Fest this year as well in Herndon, Virginia on April 23rd. You can go to fairfaxvegfest.org for all of that information as well. I can't wait to see you. I can't wait for the full season to drop. I'm absolutely hooked with what I have seen so far. And as I said, this is the best series that I've seen in a very, very, very long time. My hat is off to you. This is a tremendous, tremendous service that you're doing to so many people.
Thank you very much. And again, thank you for the kind words. And I look forward to getting to DC and perhaps we can discuss that, panel we mentioned earlier, and maybe we can do something around then.
You got it, my friend. Can't wait. Thank you so much.
Take care.
If your health IQ was a couple of points higher than it was a few minutes ago, go ahead and like this video or subscribe to the YouTube channel. And to take it even higher, head over to Apple Podcast or wherever you get your favorite shows. Look for The Exam Room by the Physicians Committee. Hit the subscribe button there as well and help to make your world